Okay, then we go to diabetes. And in fact, you're lucky in Iceland because in these 30 or 34 countries of OECD, Iceland has the lowest use of diabetic medication. And probably in your society, you are not that fat as in many other countries. Maybe you don't believe it, but if you look to the numbers, if you relate it to the other countries, you are in a quite good position. But in spite of that, you also here, you do have a lot of people with diabetes. Now, when you have diabetes in women, the clear research in Belgium was that in men, diabetes very much influences function, and in women influences much more depression. That's Paul Enslin from Belgium did that kind of research. But you find also, if you look well, you find also some minor function changes in women, but much less than in men. You can get impaired circulation, and then you get lubrication problems. Now, lubrication problem, you don't, usually women don't complain that much, but if in case you have a woman with diabetes who really says, I stay so dry, that is the situation where you could try the PDE5 inhibitors. It's the same in the MS. I didn't mention about the treatment, but the PDE5 inhibitors, the Viagra, the Cialis, and the Levitra, that is the medication which can help, especially in people where it is impaired. If it's impaired in multiple sclerosis, you can give these PDE5 inhibitors, but also in the women with diabetes, you can try that also. In diabetes, you have more vaginal infections, so more candida and that kind of things. And if you get vaginal infections, that of course reduces the desire for intercourse. And that means that usually then there is much less sexuality. You can get also the peripheral neuropathy, by which she will have orgasm problems and she will feel less of the clitoris. And of course, she will have more depression, which usually means she will have less desire. Now, if you look into the man, in the man with diabetes, the most important thing is the impairment of circulation. Diabetes is mainly a circulation disease for the majority of men. So you will get very easily, you can get erectile problems in men. You get it partly by the atherosclerosis of the major arterial vessels, but you get it also by the endothelial damage inside the corpus cavernosum. And in both ways you can get more erectile problems. Now they found that in the men with type 2 diabetes above 65, that half of them had erectile dysfunction above 65, and depending a little bit in which country, that can be higher and can be lower. For instance, in United States, if I looked into the numbers for United States and the Netherlands, in United States they have a much higher rate of diabetes because many more people are obese, and so they have also a much higher rate of erectile dysfunction in United States. So that is not a good figure to relate it to Iceland. You can have also peripheral neuropathy in the man, and then he can have orgasm difficulties. It's mostly in men, they have circulation problems, and after the circulation problems, they still can have a normal orgasm. But if they get a lot of neuropathy, then it can damage also orgasm. And part of the men, they get an autonomous neuropathy, and by that, they can have problems with the closing of the circular muscle between the prostate and the bladder. And it's already a rather well-known number from long ago that 1 out of 7 men in the first group where they showed this had a retrograde ejaculation. And they didn't look into that very much in the last decades. So I keep it 1 in 7, but maybe it's less. In men with diabetes, you can have also hypogonadism, especially if you look into the men who have the diabetes in combination with the metabolic syndrome, and then you get low testosterone, which means also low desire. And then you get into a vicious circle of low desire, no sex, it's no good circulation, and you continue. It's good maybe to tell now that if you have higher T, especially if you have more frequent sex for men, more frequent sex means that they have, in a way, they use the circulation well. And that's marvelous research from Wales, in a village where they do longitudinal research, and they look into all the men in that village over every several years, and they ask everything, including sexuality. And they found that men who have 2 orgasms a week, and they relate it to the men who have 1 orgasm a month or less, 2 orgasms a week or more, 1 orgasm a week or a month or less, then those with 2 orgasms a week have 50% less acute myocardial death, stroke, or a brain death, stroke death. Myocardial infarction, acute myocardial death, or stroke, one of the 3. So there is, and it's not a 5, it's a 50% difference. So that is, for us, very important to tell men, try if possible to continue to have sex, because it's healthy. It's in a way you use your circulation, especially for those men who don't do much other exercises in their body. Here you see what happens in diabetes and the relation between diabetes and ED. I've made this because we had, in the past, we had so much the difficulty that we didn't know. Is it psychological? Is it between the ears? Or is it physical? Because in the past, if we didn't know what to do, we said it's psychological, so we send it to the psychologist. If we understand it, we can earn some money, so we treat it. But we didn't know very well what to do. So we always were fighting, is it this or is it that? And then we have discovered that, of course, it's and. If you look into somebody with normal erectile possibilities, and then he gets diabetes, then through the diabetes, slowly it can become less. And roughly between full erection and no more possibility to have erection, we say it's in people where it's not well corrected, the diabetes, it takes about 10 years, an interval of 10 years. Now, if you're in the middle, is it psychological or is it physical? And that's what you could explain that very clearly. 2 men with exactly the same circulation damage and exactly the same neurological damage. 1 man, he loves sex, he loves his wife, and his wife can take over, and even if he doesn't get an erection, he will have a good evening. The other man is much more nervous. He believes that he has to do the job, and he's afraid he won't get a good erection. So he takes some booze to get strong enough to get an erection, and he waits till 12:30 in the night before he starts, and then his body is so tired, so he for sure will not get an erection. So sex will be shit. They have exactly the same damage, but it's what you do with it, and that's what our function could be so well, to explain that and help them to make a better sexual activity and to improve their sex life. And important, of course, especially in diabetes, for the majority of men who have a lot of circulatory erectile problems, they still can have a normal orgasm. And that's a present we can give to the patients. Just ask, and did you continue to have sex? No, because I have no erection. For many men, they always got an orgasm after having an erection. And then when the erection has gone, they stop. And they don't realize that maybe they still can have a very funny sex life. So we could help them easily. This could be part of assisting the patients in telling them to listen very well to your advice. If they are structured well in taking the insulin, etc., and their diet, and they have a good HbA1c, then they have more effect of the PDE5 inhibitors. So if they want to have sex, you can tell them, take care for the diabetes, then you can have more benefit out of Cialis or Viagra or Levitra. Okay, any question on diabetes? No questions?